Welcome back, and thank you for staying with the broadcast. Prime Minister Alan Chastanet explained to the nation on Monday during a televised NEMAC meeting the decisions taken to close some borders and to leave one noticeably open. Travel restrictions have been put in place for travelers from France, but not so for the French Department of Martinique. This is because Martinique provides critical medical services to St. Lucians in specialist areas. The government is also seeking assistance from Martinique personnel to get the Owen King EU hospital up and running ahead of schedule. Imposing travel restrictions on Martinique, the PM says, is just not feasible at this point.
There is still need to be able to interact with the rest of the world. If we take on simple things like healthcare, we're not self-sufficient in healthcare. And there are occasions, more than we like to admit, in which St. Lucians have to travel abroad to be able to get critical care. And so therefore, Martinique, as an example, plays a very important role in providing that service. And so while we have put a caution, meaning that anybody who comes from mainland France as of tomorrow will be quarantined for 2 weeks in St. Lucia. We've restrained on applying that to Martinique, and that we are developing a protocol with Martinique and Guadeloupe, both St. Lucia and Dominica in particular, as to how we're going to manage that interaction.
Martinique is currently grappling to get a handle on the COVID-19 situation after it recorded its first death due to the virus. The number of confirmed cases in the French Isle currently stands at 15. In other news, as part of preparations to ride out what will undoubtedly be challenging times during the COVID-19 pandemic, the Executive Director of the St. Lucia Chamber of Commerce is making the case for building local capacity among manufacturers and for limits to be put on the purchase of some items. More in this report. During a NEMAC meeting on Monday, the Executive Director of the Chamber of Commerce, Brian Louisi, addressed various stakeholders, drawing attention to what is expected to be a plummet in the availability of cleaning supplies and things like toilet paper. Given that the original of these supply chains is in places like China and the United States, Louisi says some of these products will become increasingly scarce. Already, U.S. citizens have engaged in wide-scale panic buying, and cleaning supplies and toilet paper are high on the list. The solution that the Chamber of Commerce has suggested to the government is to provide assistance to boost the capacity of local manufacturers so that they can begin to produce these items themselves, or in some cases, increase the production of each product.
Chamber members will, on their part, ensure that all measures are put in place to protect employees and the public as we continue to serve them. The Chamber, however, wishes to inform that there appears to be challenges in the availability of sanitizing and cleaning products. In that context, we again suggest that government should provide all possible support to local firms able to manufacture these products or convert their operations to produce these goods, as these are needed not just locally but regionally. This is critical because USA suppliers are minded to redirect these resources to their situation on the ground, and these governments could intervene to decide on where those supplies go. I point out that some local producers may be considered for such support, including Toylin, Natmed, St. Lucia Distillers, and Chemical. We recommend government needs to give active and aggressive support to these local efforts to produce the cleaning agents locally.
The Executive Director advocated for government to put in place rationing measures or some sort of limitations on the sale of some supplies given the level of panic buying by some consumers. This seemed to be the general consensus from those at the NEMAC head table as stakeholders looked to the future of managing this crisis.
I want to reiterate that this statement must be treated with caution because the situation is dynamic and depends on the source market for the goods or for the raw materials. We anticipate that there could be interruptions depending on how hard hit we are and how long the situation persists. Therefore, we believe that maximum limits may need to be placed on an identified list of essential cleaning, disinfecting items, food, prescriptions, and over-the-counter items. For example, We know that the active pharmaceutical ingredients for certain drugs come from China, and this will likely cause shortages in the medium term. We know that China supplies a large percentage of the world's parent rolls for pulp and tissue. And so until we investigate more fully our supply chains deeper, including our local and regional supplies, I can't say the above is given advisedly.
Louisi also noted that retailers and supermarkets will do all in their power to provide essential services to consumers, but he also called for security considerations to be made for retail businesses as they seek to supply grocery demands across communities.
The Chamber urges government to put measures in place, and we will support those measures to prevent panic and or civil unrest, as well as others to mitigate against criminal activity. Special provisions should be made for armed forces to be assigned to guard healthcare facilities, pharmacies, distribution warehouses, retailers, and under downtrade vehicles to reduce the burden of additional security costs to protect against disruptive, unscrupulous, and criminal behavior in the possible wake of perceived scarcity of products.
The government assured that as it stands, there are no food shortages and that consumers have no need to panic, but should be responsible with their consumption choices. Reporting for Hot 7 News, I'm Rochelle Gonzalez. As the government of St. Lucia continues to closely monitor the possible outbreak of COVID-19, St. Lucians are asked to be prepared and to avoid panicking. More in this report from Fennell Neptune.
As part of the measures to prepare for the possibility of a COVID-19 outbreak in St. Lucia, the Department of Health and Wellness wants to ensure that the public receive the necessary safety and readiness tips. Family life educator in the Bureau of Health Education, Naomi Grandison, encouraged St. Lucians to consider social distancing as a means of reducing the spread of COVID-19.
We are encouraging persons in the case of an outbreak to practice social distancing. And what this means is that you should avoid places where you're going to be in close contact with others, where there are many people, for instance, the gyms, the churches, even the supermarkets sometimes. Schools may be closed. So we basically are encouraging persons to do that, because if somebody is infected and they sneeze or they cough or they spit out in public, these droplets can rest on surfaces. You in turn can touch it and then touch your eyes, your nose, or your mouth.
Grandison also called on St. Lucians to be prepared, aware, and proactive to prevent the spread of COVID-19.
So we are advising the public to avoid panicking, but remember, preparation is key in the case of an outbreak. So for instance, you should stock up like in the case of preparing for a hurricane. So persons who are taking prescription medications, they should stock up on at least a month's supply of that, have enough water, have enough food at home, have games for the children, stock up on masks and gloves in case somebody gets sick, because that's when you really need it. And any other items that come to mind. For instance, bleach would also be a very important one, hand sanitizer or rubbing alcohol. So just prepare, because panicking in itself can have a negative impact on your immunity.
The Department of Health and Wellness once again encourages St. Lucians to be prepared for the possible outbreak of COVID-19 and to avoid panic. Reporting from the Communications Unit of the Ministry of Health and Wellness, I am Fennell Neptune.
President of the National Council for Persons with Disabilities, Murphylis James, is calling for measures to be put in place to accommodate disabled persons when it comes to the response to COVID-19. While James agrees that there is a plethora of information on the virus available to the public, as well as a mass of misinformation, he feels that the disabled are left out when information is being disseminated.
Coming out of the NEMAC meeting on Monday, March 16th, President of the National Council for Disabled Persons, Murphylis James, indicated that the council was very pleased with the vast amount of information that was out there on COVID-19. James, however, is pleading with those in authority to consider the needs of the disabled when disseminating information and preparing for the impact of the virus on the country. James is asking for other means of reaching the disabled to be implemented with the giving out of information.
What we are highly advocating for is that the government, the Ministry of Health, ensures that all official information on COVID-19, on where we are in this country, is made accessible to all persons with disabilities. There has been a lack of sign language interpretation here on messages which are of such national significance. Public safety and survival is at stake, and we need to make sure that the most vulnerable among us, particularly persons with disabilities, are being reached. So in televised addresses, it does not reach the deaf or the hearing impaired.
James indicated that coming out of the meeting, it was made mention that the disabled need to be taken into consideration.
We need sign language. We need to have subtext as well. The blind person may not fully appreciate the visual presentations that we have been seeing. So we need to have concise audio being prepared that we can easily disseminate over WhatsApp, over social media, so that everyone can receive this vital information.
He even made mention of ways that the systems already implemented could be tweaked to accommodate the disabled.
The very good suggestion of the hotline can be greatly improved upon, because you understand, a phone hotline is no good to the person who is deaf, hearing impaired, or who cannot speak. So we need to have a website with text capabilities where people can message, even over WhatsApp, where persons who cannot speak or cannot hear can type, can communicate.
The disabled forms part of the most vulnerable groups in society. As such, James is imploring the powers that be to ensure that they are included in every aspect, as some of these people live on their own. Reporting for Hot 7 News, I am Genevieve Gonzalez.
You're watching the Hot 7 Nightly News. Stay with us. We'll be right back.